I'm going to introduce one of our wonderful, very passionate PAVE advocates, Dr. Monica Wilson from California, who is a mental health expert who is going to then intro our next important panel on youth treatment and cessation, clinical updates and options for families. So I'm going to now turn us over to Monica to intro the program. Thanks.
Hello, my name is Dr. Monica Wilson, and I am a paid volunteer from Rancho Cucamonga, California. It has truly been an honor to be a part of PAVE. As a mother of 4, this organization has been a complete lifeline. My work in the community as the chair of the Behavioral Health Commission for over the last 9 years has truly connected my passion of PAVE and what I do to bring awareness around mental health. I got involved with Parents Against Vaping e-cigarettes when I decided that our children wanted to be in a safe environment and also be able to advocate for those who were not aware of this epidemic. It is my pleasure to tell you about one of our event sponsors, Truth Initiative. Truth Initiative is America's largest nonprofit public health organization committed to making tobacco use and nicotine addiction a thing of the past. Truth investigates, exposes, and amplifies the truth about smoking, vaping, and nicotine through groundbreaking research and policy studies. The nationally recognized Truth Campaign, community activism and engagement, and innovative programs to help people quit. On behalf of PAVE, thank you, Truth Initiative.
Young people know it's an epidemic.
The number of high school kids who were vaping went up 78%.
Young people know vaping is everywhere.
1 in 5 high school kids have...
Young people know how addictive nicotine and e-cigarettes can be. But what young people don't know is how to stop. This is how. This is Quitting, the first of its kind free text message program from Truth to help teens and young adults quit vaping e-cigarettes for good. For over 2 decades, Truth Initiative and the Truth Campaign have given young people the facts about the risks of tobacco. Our digital quit smoking programs have helped hundreds of thousands of people break free from nicotine addiction. This is Quitting combines this wealth of expertise to bring you a powerful quit vaping program designed specifically for young people. It features clinically proven advice from quitting experts and support from other young people who have used the program. Whether you're ready to set a quit date or are still deciding, This is Quitting gives you the useful steps to take today to start your journey to ditch your vape for good. Everyone has a cell phone, and text messaging is the preferred way to communicate. This is Quitting provides help the way you want it, anonymously and privately, and it's available 24/7 for support right when you need it. This is Quitting is easy to use. Just text Ditch Vape to 88709 and you're in. You'll get non-judgmental tips and advice and tons of encouragement from other young people who know what you're going through. Even if you feel like you're the only one quitting, you're not alone. Since we launched the program 2 years ago, the response has been incredible. More than 500,000 young people have enrolled in This is Quitting, and it's working. And now, a clinical trial found This is Quitting increased quit rates among young adults aged 18 to 24 by nearly 40% compared to a control group. But the best news is the real impact This is Quitting is having on real people.
Love you. Thanks so much for all of the help. I'm feeling confident already.
This is amazing. I've never gotten this much support right off the bat.
Thank you for your help, even if you're not real.
They come every day, and they're always there when you need them.
This is working. This is freedom. This is the fight to live vape and nicotine-free lives. This is Quitting.
Hello there. Welcome to our panel discussion about cessation and what we can do to help youth that are addicted to nicotine. And I have with me today a very wonderful panel. Let me introduce myself briefly. First, I'm Laura Searcy. I'm a pediatric nurse practitioner, and I've been doing policy advocacy and substance use prevention work for many years. Got involved in the e-cigarette issue right back in 2014. And just so glad to be leading this panel of real experts today that I hope can answer a lot of your questions and help you feel like you've got some help and a plan if you're dealing with a child that's struggling. And first, I'm gonna let all my panelists introduce themselves. Megan, will you go first, please?
Hi, thanks so much. My name is Megan Jacobs. I work at Truth Initiative in Washington, D.C., where I oversee product development for all of the quitting programs that we run, including resources for adults who quit tobacco, as well as for parents, specifically called becomeanx.org, and also our teen and young adult quit vaping text message program called This Is Quitting.
And next, Dr. Jonathan Avery.
Hi, I'm John Avery. I'm the Director of Addiction Psychiatry at Weill Cornell Medicine and New York Presbyterian Hospital, also the Program Director of our Addiction Psychiatry Fellowship. And I also run a couple of youth nicotine treatment programs, and very fortunate to be on a panel with all of you and to collaborate with PAVE over the years. So thanks for having me today.
Dr. Yasmin Hurd.
Hi, I'm Yasmin Hurd. I'm the Director of the Addiction Institute at the Icahn School of Medicine at Mount Sinai in New York. I run a pretty multidisciplinary research program as well. And while my research doesn't focus specifically on nicotine, we more so even cannabis, a lot of the things that we study relates to the developing brain. And so I hope I can add some knowledge to this great panel. Thank you.
Thank you. And Dr. Rachel Boykin.
Hi, everybody. I'm Rachel Boykin. I am a pediatric hospitalist at Stony Brook Children's Hospital in Long Island, New York. And I've worked for a long time with both our New York State Smokers Quit line and with the American Academy of Pediatrics in various ways. I'm currently the education chair of the section on nicotine, tobacco prevention and treatment. And I'm very interested in vaping behaviors and addressing vaping among teens and young adults. So I'm thrilled to be here.
Great. And my first question for you today, and I'm going to have Dr. Hurd lead this one off. Can you tell us what is addiction and why are teens so much more at risk for addiction than adults, both to nicotine and other substances?
So I think, everybody thinks of addiction and understand that in one way, it's this inability to stop using a substance or engaging in a behavior that despite its negative consequences, they continue using, and a lot of the negative consequences can be both psychological and even physical harm. Nicotine is hands down one of the most highly addictive substances out there. And I don't think that people realize that. And in large part, a couple of things of why it's so addictive to the brain, but the receptors where nicotine binds are really abundant, throughout our brain, but in areas that's important for reward and so on. And the way in which nicotine is consumed in the body through smoking, you have this very rapid effects on the brain. And that rapid effects on these receptors in the brain makes nicotine extremely addictive. The issue about adolescence and the adolescent brain is it's like in one way you can say the perfect storm. So the perfect storm of a drug like nicotine in cigarettes that teens have access to easily, together with the fact that their brains, I just said that nicotine is also highly addictive, even in adults, but the adolescent brain is still developing. And the development of the brain during this time really lends itself to adolescents being more at risk, because areas of the brain, such as our prefrontal cortex, which really regulates, our cognitive control, that has not yet fully developed until we're in our mid-20s or so. And so that prefrontal cortical area that normally in adults tell us don't do something, or, this has really strong inhibitory control over things that impulsivity or things that we want to do that we may know that is not necessarily good, that is reduced. So that connection in our prefrontal cortex to other brain regions, another area called the nucleus accumbens, really important for reward. So the prefrontal cortex doesn't have as much control over it. So there's much more reward sensitivity in the adolescent brain. Also another brain region called the amygdala, which is important for emotional regulation, that is very highly active in the adolescent brain. And again, our prefrontal control is very weak during adolescence as compared to adulthood. But I think one of the things as well, in addition to how the adolescent brain is still developing, the important aspect is also where nicotine is binding. It binds to these nicotinic, they call them acetylcholine, one of our natural transmitter systems in our body and brain. And these nicotine receptors are also having their developmental process during adolescence. And in fact, the adolescent brain, they're much more sensitive for these receptors to be changed with nicotine exposure, much more so than adults. And it's this combination, as I said, of all of these factors that makes the adolescent brain much, much more sensitive.
The thought comes to my mind, and for the rest of you, could you comment on this, that we know a lot about changes in the composition of nicotine. We have nicotine salts from Juul. We have synthetic nicotine, advances in nicotine chemistry. Have these made the addictiveness of these products greater than the original cigarette that we were also concerned about 20 years ago?
I can start, and then the others can also. I absolutely. And one of the things when you think about these, like the nicotine salts and the synthetic nicotine, sometimes what they do is that they make the natural nicotine that's harsh, really. So a lot of times when people might even start smoking, they will say this, it has some negative effects. Some of these synthetics, they are very smooth. So the teens then, oh, this is a nicer, the flavors and things like that, that will make it more addictive because the negative part of it they're not getting. All they're getting is the reward. That's very dangerous.
And that really leads nicely into the next question. Now that we understand how addictive nicotine is, what are some of the key factors that make e-cigarettes, vapes, and some of the other alternative nicotine products out there so attractive to kids and so difficult to quit? Dr. Boykin, do you want to start us off?
Yeah, absolutely. So, you know, I think we all know that vaping has been the most, e-cigarettes have been the most popular tobacco product since 2014, and their use has really increased. That's why we're all here at this conference, I think, and it's stayed at a very high level, and that's for many reasons. I think, to just piggyback on what Dr. Hurd was saying about the particular susceptibility that teenagers have to nicotine. The tobacco industry knows this, and we know that 90% of smokers, cigarette smokers, start before the age of 18. And so that is just, there is that susceptibility. These products have been marketed to kids, and I think, they since the first generation came and sort of looked like a cigarette, and now it's turned into, I think we've all seen what Juul and Puff Bar, the most popular ones now, look like. They're sleek, they're kind of sexy, they're easily hidden, they come with different colors, they're very attractive to kids. And I think you can't avoid thinking that they really are marketed to kids. Add to that the flavors. Dr. Hurd mentioned flavors. There's over 15,000 flavors, and that is something that we know from the studies have been incredibly an incredible incentive for kids. I think for several reasons. It appeals to them. They like the fruit flavors. They like the dessert flavors, menthol and mint, which I'm sure we're going to be talking about later. But flavors are attractive. They also carry the message that it is a kid thing, right? I mean, a lot of these things, when you think of the names of some of these flavors, they mimic childhood things like Fruit Loops, and they have crazy, wacky flavors. This sends the message that it's not only fun to do, but also harmless. And so there has not been enough understanding of how harmful these products are, even now, even after we have sort of recognized some of the dangers with the Ebola epidemic that happened, in the end of 2019. So there's a lack of understanding. And then you add to that the flavors. The other things that when we study what make kids want to start or try these things, certainly peer pressure. We know that teenagers respond to their peers, and that has been a big part of it. And curiosity. I think kids don't want to smoke. Smoking has gone way down. They recognize that as bad, but this has been marketed, and they still think this is really something they don't connect as even a tobacco product. Some kids don't even recognize even now that this is a tobacco product. And then just to circle back to what Dr. Hurd was talking about with the particular susceptibility in the new products and the nicotine salts, which make it easier to use. These are also products which pack an enormous amount of nicotine in them. So Juul, and then the subsequent generations like Juul, like Puff Bar, for example, the disposables have 5% and above nicotine, which is, if you see one of those little tiny pods, that has, the equivalent, it delivers the equivalent of a pack of cigarettes, which means if you think of a kid using them, on a daily basis, that's a lot of nicotine. So it kind of stands to reason that they're going to get addicted pretty quickly, just by having those things easily accessible, easily hidden, and used frequently.
I can add a few thoughts to the addictiveness of these products. One, I think it's the perfect first question and answers to any talk on this, because at times, as parents, even as providers, we can think these are like bad kids doing bad things, as opposed to, people that have been hijacked by a disease process, by hijacked neural pathways. And so it's always important for parents, and even for people struggling from it, to recognize it's not a moral failing. And, one of my favorite sayings in recovery is, we're not bad people becoming good, but sick people becoming well. And so it's the right frame for any discussion on youth nicotine use. And I'll add to the addiction. I used to have these in my office to show parents, and I almost started using, because they are sleek and addictive. It is that cool factor. It is the hijacked reward pathways. And then I think the final thing that propels use forward, or another big factor, is that nicotine withdrawal is such a bear. And so if you think about some of the risk factors for addiction, mental illness, trauma, difficult social environment, and now you're trying to combat nicotine withdrawal, which causes anxiety, insomnia. You don't want to feel that way, especially if you're in an at-risk group for really, experiencing those things as big stressors. Then you want to start medicating that withdrawal state and those uncomfortable feelings, and that too can keep the use going forward and result in a substance use disorder or an addiction to this product.
You mentioned the mental health and behavioral health aspects. And one of the things that I've read a lot of research studies on recently that really does concern me, we know our youth were having a mental health and a behavioral crisis even before COVID that was extremely exacerbated by COVID. But the research coming out that, contrary to that common out there belief that, oh yeah, we smoke a cigarette to calm down, or we use nicotine to manage stress, is the studies that say that nicotine use in youth actually amplifies depression and anxiety and makes it worse. And I think that's also something really important for people to know, that this is not helping kids manage their stress, it's making it worse.
Yeah, and I could just add in terms of the, the neurobiology of it is one of the things as well. So when those receptors where nicotine binds, they're changing to such an extent, and they modulate, they're parts of those brain regions that regulate anxiety and depression, an emotional state. And then during the withdrawal, there's this ramping up of these systems. And so it exacerbates their anxiety, exacerbates their depression. So it's just a really bad cycle for the brain.
Mm-hmm. So as a parent, I'm concerned that my kid is using this vaping product a lot, and I've caught him at it. And the normal things I do to try to modify that teens at around behavior isn't working. I'm really concerned that there's some dependence going on here. And so how do you understand how intensely addictive a child may be to these products? And what are some of the tools available out there to help diagnose or understand the severity of nicotine addiction, so parents will feel like they have an idea on what's a reasonable approach to handle it?
So I can start us out on that one. I think there's kind of two questions. The parents' approach, number one, I think to acknowledge this kind of goes back to what Dr. Avery was saying. These are not kids being bad, and so I think I have a teenager at home. It's very tempting to just start to yell and get upset when you find something, but to recognize the motivations that were behind, and now the addiction, the likely addiction. So the first thing is to have an open conversation and to try to really understand, to let that teenager understand that you are there for them, not against them. And so education is key. Again, a lot of these teens don't really understand how dangerous it is. And when we've done focus groups with kids to try to understand how to help them, they actually want more education. When they understand, teenagers don't want to be controlled by anybody or anything. So when they understand that they're being controlled by an addiction or by an industry being marketed to that way, they don't like that. And so I think for the parent to step back and understand that they have to have the question many ways. So asking the question about what you're doing, that takes me to kind of, both from a pediatrician and a healthcare provider standpoint, and as a parent, we have to ask the questions the right way. A lot of the questions are still focused on tobacco, smoking as the only tobacco product, and this is still a tobacco product, but it's not smoking. So if we ask a kid, are you vaping? They may say no, because they may say they're juuling, or they may say that they're doing something else. And so we have to be very specific. We have to ask about the products. What are they using? How often are they using it? And this goes for both healthcare providers and also family, I think. And I think trying to quantify how much they're using, those little pods, there's a hand to mouth thing that can happen. So I think a better way to quantify it, we're used to sort of trying to ask how many cigarettes a day does somebody smoke? Well, you can't do that with these products because it's kind of a continual behavior. I usually ask something like, well, how many of those do you use in a day or in a week? And do you share with your friends? Because kids will share. So to get an idea, and again, just to remind you that one of those pods delivers about a pack of cigarettes. That's a lot of nicotine. So that gives you some idea. Some of the other behaviors from a parent standpoint, if the teenager, going back to what Dr. Herb was saying, withdrawal is pretty bad. So crankiness, failing grades, or changing grades, changing behaviors are potentially signs of withdrawal or addiction. Often these things are done in secret, but if you notice that you can just ask them that your teenager is waking up in the morning and needing one of these things, that is a sign of addiction. From a more sort of objective healthcare provider standpoint, there are several tools that can be used. And as parents, I would encourage parents to share these with their pediatricians or whomever is taking care of your kids, because this is something that we are still, as pediatricians, are still catching up with in terms of how to address this, because it's just hit us so hard. But there are really 4 validated tools that are now being used to identify addiction in teens, and some of them are very short. The e-cigarette dependence scale is one of them, for example. The CRAFT is another. And they ask questions like, do you feel that you need to wake up and use one of these products? So it gives a measure of the level of addiction. I think that it's very hard to quantify exactly how much, but if a teenager can tell you that they feel like they are a little out of control with this, that's already something that needs to be addressed.
I'll weigh in to add to this. So as I mentioned, we run several different programs out of Truth Initiative. We have one for parents specifically that includes web-based resources as well as guided text messages that can help parents work through their own emotional response that they may be having to finding out that their child is vaping, which can be very stressful and frustrating or even disappointing to parents. And so we have resources specifically to help parents navigate their own feelings and connect with other parents that are going through this, as well as guide them through how to help their child quit. And through This Is Quitting, which is our text message program specifically to help teens and young adults quit, we've served almost 500,000 teens and young adults since we launched this program in 2019. And one of the questions that we actually ask is, how can your friends and family best support you in your quitting? We know that young people, as Dr. Boykin said, they want to feel like people are on their side, and that includes their family and their parents, as much as many of them have been hiding it from those people. And I think the biggest thing that's come through for me over the past couple of years is that you should ask your child how they want to be supported, because the way that you want to receive support may not be the same way that they want to receive support. So we've had some young people say, I want accountability. I want my parents to check in with me, see how it's going, essentially put my feet to the fire about it, to hold me accountable to quitting. Other people say, I need my parents to back off. Trust me that, you've given me the information. I'm going through this quitting program, or I'm quitting on my own, and I'll let them know, when I need help or when I need checking in with. And so even just opening that conversation of how do you want to be supported, I think can build a lot of that trust and relationship building that is going to be so essential to providing that support. And it's very similar to what Dr. Boykin said, but you are not going to be able to punish your child out of an addiction. And it's really going to take the same kind of family team effort that you would give your child who's undergoing any other kind of treatment for any other kind of disease or mental health problem. Like Dr. Avery was saying, this is not something that you're just going to be able to yell or punish your way out of. But there are definitely real ways that you can support your child.
And that brings up a really good point in that for adults, there are tried and true FDA approved medications, and the gold standard for treatment is using one of those FDA medications and perhaps some group or behavioral counseling. But when this, since 2014 on, when this wave of primary youth nicotine addiction, which we never had before, hit, we found ourselves kind of with less tools in our toolbox for cessation, because all those medications are approved for adults, but not for kids under 18. So Dr. Avery, could you kind of take us through what some of the pharmaceutical options to help kids quit are? And then I'll also cycle back to the others about, Megan mentioned This Is Quitting, but what are some of the other non-pharmaceutical based supports out there that have been helpful for kids?
Right. To start, and adding to the last point, I think part of treatment is prevention. And so we do want parents to, address this early on for their kids, just like, with the mental health crisis, it was in the news that you should start talking to your kid as early as 8 about anxiety and mental health issues. And we think a similar age actually to start talking about substance use at age 9. And so, you don't want your first conversation or approach to treatment to be in that crisis moment, when they're 17 and you find the jewel and you guys are screaming at each other. It's best that you have an ongoing open dialogue. This is something that we can, talk about openly as a family and address with treatment if it comes about. And there are good treatment options, and sometimes sometimes the treatment is about, well, even stepping back, you might think from all the things we said about addiction that everyone that tries juuling and vaping is going to be addicted and their lungs are going to explode. But in fact, most people stop juuling and vaping without any intervention. And most people aren't addicted. And if you find a jewel, it doesn't mean that it's no college and a short trip to the end of the family unit. And so that's why you have to sort of right size it with those early conversations. So because potentially no intervention is needed other than some basic education and talking and figuring out what's going wrong. But for those who are seriously in trouble, they develop a nicotine use disorder, they can't quit despite efforts. You want to make sure you address any co-occurring mental health issues that they're self-medicating. And so, the treatment might not even be meds yet for nicotine use disorder. It might be getting them a therapist or a psychiatrist, and the meds they might need might be an antidepressant, or the treatment they might need might be to that anxiety disorder. But if they don't stop on their own, the mental health stuff is addressed, and they're not quitting, then we start to use some of these medications that aren't FDA approved for adolescents, but there's an increasing evidence base that they can be helpful. And those are medications like varenicline or Chantix, or bupropion or Wellbutrin, that you can use about a week before you set a quit date. And there's nicotine replacement treatments, the patches and the gums and the lozenges, to help taper off and avoid that nicotine withdrawal that propels use forward. And often people start with the nicotine replacement, and then if that fails multiple times, then they might add one of these medications that aren't FDA approved. And the American Academy of Pediatrics came out with a little guide for pediatricians. If your pediatrician isn't sort of aware of these options, and you don't necessarily have to go to an addiction professional to get these things, but it's likely that your own pediatrician with a little education, hopefully they are ready to tackle these things.
Yeah, I was just going to jump in and say, particularly with the nicotine replacement therapy, which is, as most people know, available over the counter for those who are over 18. It is, off-label, and some pediatricians are still uncomfortable with prescribing it. You can give it to somebody under 18 with a prescription. The policy statement from the American Academy of Pediatrics, which really does direct the best evidence for pediatricians in dealing with this, does say that for teens who are addicted, that it is recommended to use nicotine replacement therapy. So I think pediatricians are understanding this. We do all sorts of things that are off-label that just haven't been well studied in kids when we have to. And I think this is becoming more of a standard, but it may be that people's pediatricians are not as comfortable. And that is, again, where I think a little bit of just a reminder, and we're really trying to change that paradigm a little bit, because to normalize it, it really should be a no-brainer. It's when people will say there's not a lot of evidence for NRT, nicotine replacement therapy, gum and patch in kids with smoking, and certainly we don't have enough time for studies with vaping, but part of that is because the studies have been small, because it has not been focused on kids. And so I do think that lack of evidence doesn't mean lack of study doesn't mean lack of evidence. It means that if somebody really needs something to try, it certainly is a safer option to me than continuing to use these products that we're talking about.
I'm glad you brought up that part of evidence-based treatment approaches for tobacco addiction and nicotine addiction are behavioral interventions, behavioral programs. So we recently ran a clinical trial of This Is Quitting among young adults ages 18 to 24, which demonstrated a nearly 40% improvement in quit rates over people who were trying to quit unassisted. And, a roughly 25% quit rate among young people who are using this program is pretty good. It's way better even than many young people who try to quit with no behavioral support using nicotine replacement therapy, right? So using these products can be synergistic. We certainly wouldn't want a young person trying to quit with only medication, but not any other either support people in their life or a supportive, behavioral program that can help them understand how to make behavior changes, like coping with cravings or withdrawal, or how to deal with different social situations that they might find themselves in. And so, that behavioral component is definitely evidence-based, and we're running a similar trial right now of This Is Quitting among teens, which hopefully, if we have to have another one of these webinars in the next couple of years, I'll have data to share about that. There are some other behavioral programs that are available free nationally. This Is Quitting is nationally available for free. Young people anywhere in the country can text Ditch Vape to 88709 to sign up for daily text messages to guide them through the quitting process. And there are also other programs that may be available through something called your state quit line. So many adults who are not tobacco users don't necessarily know that their state even runs something called a quit line, which is a free resource that is available by calling 1-800-QUIT-NOW, or pretty much every state is going to have a website. If you just search on Google your state name plus quit line, you'll find your state quit line website that may have other resources available as well, including the availability to talk one-on-one with a trained tobacco treatment specialist or quit expert by phone, and sometimes also by live chat on the website or through text message maybe. So there are other options that are available for free nationally that you are certainly worth looking into.
Megan, I think you bring it. Go ahead, Dr. Hurd.
No, I was going to say one of the things that we have to also remember, there is not one medication or one behavioral intervention that will work for everybody on this planet. And that's why it's really critical. And I think Megan said it earlier, you got to know your child also. And there are a number of studies, not only focusing on cigarettes, but trying to understand what are the subgroups, what are the behavioral traits that might lend itself to one type of therapy, one type of intervention versus another. So I think that that's one of the things sometimes people think they tried this thing and it didn't work, so that's the end of it. you sometimes actually have to find the thing that actually works for you or for your child. And that's, I think that's, really important for all substance use disorders in general. And another thing that's important about the adolescent brain, that I come back to what I started with, and Megan, you pointed to some of this as well. The prefrontal cortex, I mentioned that, yes, it's still developing, but actually it also provides an opportunity for strengthening it. So making sure you give your kids and make them part of this cognitive decision-making process. Sometimes we wait too long. So Dr. Avery talked about, prevention and is really critical. And Dr. Boykin, prevention is also linked to helping your children think independently in positive ways. We talk about positive learning. Actually, that strengthens our prefrontal cortex. So these are things that, on a biological point of view as well, why this type of strategy is really critical. The behavioral components can't be underestimated.
And then I was just going to jump in with one more thought on that, which is, again, it goes back to the concept that addiction is really like any other disease process. You don't just fix it like you fix an appliance that's broken. And I think we have this, especially as a parent. I know I certainly, as a parent of a teenager, have had many moments where I just want to end something that's happening because I know it's not good for my kid, whatever the behavior is. And that's not the way it works. And as Dr. Hurd said, kids really teens need to they want to take control of what their behaviors and their future. And it's a process, and it's very hard as a parent, because I think you feel, and as a physician too, I can say this, you feel like a bystander who's just waiting for something to happen. It takes time. And so the other thing is that, most people, and this is based on adults, but I think it's fair to say with teens probably too, who are truly addicted to nicotine, a lot of people have to make more than one quit attempt. And so they may say they've tried it, it didn't work. I do think we do need a multimodal approach. It's also okay to go back to something that didn't work the last time, because it may work this time. And so to understand how much of a process it is, and to really steel yourself to accept incremental improvements, that's really important. It's so hard as a parent to do that, but I think it's the only thing that's going to really be successful for a lot of these kids. It's not just going to happen overnight.
There's an axiom that someone told me when I first started working in tobacco, which is that the only predictor of successful quitting is quit attempts. Trying to quit is the only thing that will predict successful quitting. So I think that experimentation is really essential, and that something you should encourage your child to almost want to explore, because more likely than not, they are going to need to experiment with different methods of getting through cravings, different ways of coping with stress, different ways of dealing with social pressures. They're going to need to try and figure out what works best for them. Dr. Avery, go ahead.
Yeah, and we were circling it, but just to say it, sometimes the treatment is not even for the kid, but for the parents or the family unit too. And so, you can't have the 3 drinks at night when you come home to deal with stress and then tell your kid not to juul. You do have to be mindful of how you yourself are coping and modeling different behaviors, and you often have to check your own pulse before you can put your own oxygen mask on first before taking care of others. And so I think that's often part of treating any kid, adult, partner. You do have to make sure everyone is approaching mental health issues and substance use issues in a mindful, thoughtful way, and getting the care they need, because it's hard to change in an environment that's stressful.
So let me expand on that a little bit. We've identified that a teen has an issue. They've availed themselves of all the options out there, figured out one that works for them. They and their parents have had the conversations. Now they're off the nicotine. They're through withdrawal, but now they're going back to school. where every time they go to the restroom, every kid in there is passing around a Juul, and they're going to play Fortnite or whatever the new video game is with their friends, and they're passing around a puff bar. So how do we strengthen kids with those coping skills and those refusal skills, so they're just not, forgive the bad analogy, I don't mean it as a pun, but so they're not just sucked back into the same behaviors again because of the peer pressure?
I'd love to start with this. I welcome certainly the other panelists' perspective. Something that we have heard from so many young people who have used This Is Quitting is that when they tell their friends that they're quitting, their friends are very supportive, even when their friends are vapors. And that letting people know that it isn't something you want to do anymore, it will really, really help them either not offer it, or if they do offer it to you, when you say, no thanks, I'm quitting, or hey, I'm really trying not to do that, it has been surprising to so many young people who have used our program to find that support, that when they tell their friends that they are quitting or that they don't want it, to see how supportive those people in their lives have been. And this is kind of, I think maybe unfortunate to a lot of parents to hear. They're probably going to want to be on their phone a lot more. Text someone who is supportive, watch a video on your phone, play a game, find something else to do with your hands. But a phone can be a really, really supportive device. Obviously, sometimes on social media, that can be hard if they're seeing people vape on social media, and that's triggering, but there can be a lot of ways that their phone can be a really great resource for them. And I'll just plug again that for anyone who signed up for This Is Quitting, they can text This Is Quitting anytime. We have a number of different keywords, like they can text stress and get an instant message back from us about how to help cope with that, or they can text in, if they're having a craving or if they've relapsed. And so text message programs like This Is Quitting can be very supportive in that way as well.
And that's right. I mean, prevention messages have shifted from to more like it's okay to be you. And I think our kids are better about discussing mental health illnesses and tolerating differences than even my generation when I was in high school. And so the fear is often greater than the actual experience of what would happen if you say, I'm not going to do X, Y, or Z. People tend to be accepting, and it's often viewed as a sign of strength and not of weakness. And kids sometimes have to learn that positive lesson for themselves, and when they do, they feel good about it. Plus, as people progress through high school, people start getting picked off for substances, and they start seeing sort of more evidence of the negative side effects. And so, the evidence shifts to it's sort of cool to not use. And I think in general for juuling and vaping, there's been a shift over the years from it being sort of cool to, I think it's happening even faster because of social media, whereas it took decades for cigarettes, to really create that. I think more people think it's a negative these days than even a few years ago.
And I would add also that I agree with everything that's been said. Being involved, this is kind of more of a prevention message. Being involved with the schools is really important, because again, what kids say they want is they want the adults in their schools to understand the concept of addiction. They don't want to be punished. They want to have those teachers who are ignoring the kids juuling or vaping in class because they're so easily hidden. They want those teachers to be educated and armed with the ability to just call it out, not to get their peers in trouble, but because they don't want it normalized. A lot of the kids we talk to, including those who are the people who vape in the bathrooms, they actually they want to change the culture there. And I think there's a lot of opportunity for parental involvement there to work towards that. And I think there's a lot of opportunity for kids to be involved with that peer support. So I do think this is, again, as all treatment is, it's a multi-pronged approach. But I think one of the important messages is that kids are not addicted alone, and they don't have to go through this alone. They have their parents, they have their peers, and they should also really feel like they have the support of their school environment. And that's an area where we really can focus, I think, as parents and also health professionals.
I'm so glad you brought that up. I've heard, not as much recently, but especially at the beginning of this vaping epidemic, how many schools were taking punitive measures, especially for student athletes. So, student athletes who were caught vaping were getting kicked off the team or penalized, not being able to play in games, suspended from certain amounts of time. And I personally think this is really, really damaging. You're taking a hobby that is so positive and productive in a young person's life and that could really help them navigate their way through this. One of the biggest things we tell kids to do is, find an athletic or, exercise-based outlet. And so working with your child's school, to Dr. Boykin's point, to reinforce that those kind of measures do not help people quit. They will not help young people overcome an addiction, and they may, in fact, be very detrimental. And hopefully you can help build a supportive school environment and an athletic environment as well.
And I was going to actually say something related to that, because for me, we have to remember, you're right, all those punitive things actually pushes towards more of the addiction, because you increase the stress in those children's lives. So you're not doing anything as a education system to help children to achieve their full potential by kicking them out, making addiction to be so horrible, rather than using it as an educational opportunity for everybody. But I'm going to come back to perhaps my neuroscience and brain here. We have to remember that addiction is also about memory, and that triggers and the cravings that go on and the negative withdrawals and so on. So during the time when kids need, they're trying to in fact, stay off and cope with all the things, it's about new memory. We're never going to erase that old memory. We know that now, how the brain works. So, because I said the emotional triggers, the stress, will bring them back to that old memory. So the question is, how do you help your kids create new memories, positive things that then can not replace the old memory, but it becomes more valuable? And, Megan, you just said it, extracurricular activities of exercises, but find the things that your kids find joy in, magnify those things so that they can learn new things. As the brain is learning new things, those memories are can become stronger. So it's a combination of all of this, but we can't forget that this is a time period of extreme growth for the brain. And it's not just the negative things that can get encoded in the brain. We can put positive things, increase, like I said before, enhancing cognition. It does make an impact. It really does. So help your kids to find, whether I'm terrible at meditation and mindfulness, but their brains actually are much better at it. And, these are things that we think that they may be small, but actually they can be helpful.
In my community, the buzzword in the addiction in the recovery and recovery support community is that the opposite of addiction is connection. And, nicotine and other drugs kind of hijack your brain's risk and reward system and, give them that feeling of positive from a substance. But we want them to get their fun from friends, from school, from family vacations, from sports, from creating those opportunities where they get those natural buzzes of dopamine that makes them feel good from those other things. And to your point, Dr. Hurd, the more of those positive experiences you have, and you're saying that will help them in their efforts to maintain their abstinence from nicotine.
Well, and I just want to piggyback onto that for 2 seconds also, because, we know from what we talked about before that nicotine really affects pretty much all of the functioning that kids require, right, to flourish, both their cognitive and their physical functioning. And for a lot of kids, at least, from a clinical standpoint, you have that track runner who's now going to get kicked off the team or not able to run as much. Flipping it to the positive, how much better will you run without it? Or that person who really is aspiring to do the science fair, you're going to be thinking more clearly. Flip it to the positive to maintain the motivation for something that they already love, and then yes, explore the things they may not have explored. But I think kids really it needs to belong to them. Whatever their motivation is going to be, it needs to really belong to them.
The trap with this advice is we give it to the kids. We tell them you've got to, what are you doing? The number of times I've heard, I gave birth to you, why aren't you doing X, Y, or Z? Like you have to let them you have to create this environment where they can sort of explore it and get the educate without we have to know this, but without saying it. So, and it depends, like Megan was saying, every kid's different. So some kids do want to be told and want mom and dad there, but others really need some space to get there themselves, and so we just have to be, this is like the ideal to get them in sports and friends, and but sometimes it's a little tricky in navigating each kid's personality to get there.
Yeah. Well, we're reaching the end of our time here, and this has been wonderful. Does anybody just have any last minute 10-second piece of information or blurb that you'd like people to remember?
I'll go first. I'll just, go ahead.
Saying this is the brain development during this time period is amazing. And it's an amazing time for putting positivity. So make sure that you remember, and I think everybody's saying every child is an individual. And this is to make sure that, we use this time period for encoding really positive things as their brain matures. It's not about addiction. It's really can be a temporary phase.
I was just going to say that the majority of young people who vape want to quit. They try quitting. It is possible. We see it all the time. Success absolutely is possible. And it is so, so worthwhile for your child to try quitting in whatever way feels comfortable for them. And for you as a parent to support them in exploring those different ways of quitting, because success absolutely is there for them. And it's so incredible once they get to the other side of it.
And I'll just add that takes patience. Patience. I think tend to be focused as parents on getting into college, getting into having a good start in a career. Sometimes we've all slipped back, and if you see your child, your teenager having a tough time, be there, connect, be patient. It's a journey together, and try not to look at this as something that, as has been said by everybody, that will increase the parental stress, because then you cannot, as Dr. Avery said, put on your own oxygen mask first. So be patient.
Yeah, that's what I was going to echo. Everyone's doing the best they can here. It's pretty tough sometimes, this life, and if we can create these environments that allow them to be their best selves, and certainly make them aware that there's a menu of options to help them when they struggle, from mental health to psychosocial to the different meds, that one, they're not alone, and two, many options exist that can help people get better. And if you can carry that with you, then for anything and any stress in life, then you tend to eventually choose the healthier options. So.
Well, I want to thank each and every one of you so much for all your wonderful expertise and your encouraging words, and for your willingness to spend your time with us here. So I so much appreciate it. And with this, we'll conclude our session. Thank you so much.
Thank you.
Thank you. It's been
Thank
great.
you.